one of the first basic measurements we're going to make is the crown rump length, and that's simply a measure of the distance from the top of the head to the bottom of the body. The units are millimeters, and your measurement is 55.9 millimeters. 50 is 2 inches. 56 would have been 2 1/4, so it's just shy of 2 1/4. Tells me that you're 12 weeks and no days, plus or minus 1 or 2 days around that measurement.
Okay, and tomorrow would technically be 12 weeks exactly.
That fits. We're going to measure the rate at which the heart is beating, and we like it to be between 140, 180 beats per minute, and your measurement is 159.
Is that great?
Well, you tell me now. Between 140 and 180, and you're at 159.
I need a lot of reassurance. I need a lot of reassurance.
You're going to think along with me.
I'm a very nervous patient.
Yeah, okay. You're not going to get much sympathy from me. I want you to know what's going on.
Thank you.
We're not the kind that says everything is fine, go home. We like people to really know what's going on. So you're going to have to tolerate us for the next few minutes.
All right. Okay? Sounds fair.
What we are going to measure and focus in on is the amount of fluid in the neck of the fetus. And it turns out that every pregnancy has fluid in the neck, and that fluid separates the skin on the surface of the body from the underlying muscle mass. This is a story where less is better. The smaller the amount of fluid in the neck, the healthier the pregnancy. We're going to take three separate measurements, and we're going to use the largest measurement of the three as a basis for our calculations. And as I've been talking, Joyce has been trying to take some pictures and freezing them. The fetus has to be in the right position right now, sort of looking at us, and we want to really come in from the side to look at the neck, so that sort of slows us down a little bit. We'll show you exactly what we're measuring and what that numbers are, and then we'll begin.
I do have one question
Please.
for you. In addition to the nuchal translucency that you'll be measuring, will you also be looking for the presence of a nasal bone and any of the parameters for the femur length?
No, femur length you can't do. It's too soon.
Okay.
That's the second trimester measurement.
Okay.
A nasal bone depends on, again, the positioning of the fetus.
Okay.
Now, the fetus here mostly is face down, and the answer to that would be no. You can't find the nasal bone when it's face down. If it turns itself around and face up, you might be able to. So that's, now the fluid in the neck we can do face down or face up.
Okay.
But the nasal bone really has to be face up. You ready? Okay, so let's show them what we're talking about. Do you see, we put an arrow, do you see that black area?
Yes.
The white above is skin, the gray below is the muscle mass. We want your measurement to be between 1 and 2 millimeters. We do not want it to be 3. And your first measurement is 1.3. Okay, so we want it to be between 1 and 2.
Okay.
Not 3, so that's the first one. Here's the second one. You can appreciate again where the dark line is. The white skin, where the mass. This one looks a little bit bigger, but it's actually not. It's 1.2. So we have 1.2, 1.3.
Okay.
And here's the third. That one should be a little bit bigger. Again, it depends on the magnification. Down, down, down. And that one is 1.5. So we have 1.235. We're going to use 1.5. So we wanted it to be between 1 and 2, not 3. And your biggest one is 1.5. Okay? With me on that?
Mm-hmm.
We're going to to scan the entire length of the baby's body, we will look at certain structural, and his femur length is not going to be one of them. And it turns the transducer around, and this is a cross-section of the brain. We're going to be looking for what we call, you have it there, butterfly wings, except, yeah. Now these, let's put the arrows on the butterfly wings. There, and there. Those are the ventricles of the brain, and we use that as a marker to tell us that in general the brain is developing appropriately. We're going to move the transducer down. You see the heart beating and the two hands and arms. One there and one there. Don't forget this is a 2D representation of a 3D situation.
Is that the actual baby moving, or is that because of the? Okay.
Yes. Now, it looks like a little bit like a crab because of cross section, and you see both hands coming in and out of the field. Part of the other stuff there is probably the umbilical cord. That's all over the place. It looks like grapes.
Nice little legs.
Squirmy little thing.
Now, we want to go below the heart to see if we can see the stomach. There it is at 5 o'clock, and that was there, right there. He's rotating. He's not staying in the same place. We want to go down and see if we can get the heart, stomach. Nope. Okay, that's fine. We don't want to see it dilated, big, black. We're going to go down further to the bottom of the body. We want to make sure the bladder is not. So there now you're saying, if you hold still for a second, 2 legs and the umbilical cord. And that's one of the legs. This is the other leg. And the vibrating structure is the umbilical cord, which is vibrating with the heart beating. So let's take some pictures for you.
Excellent.
For your personal file. Joyce will look around, and then I'm going to have you wipe yourself off, sit up, and we're going to discuss all these findings
Excellent.
and what it means, and where do we go from here.